To determine the correct brace size, measure the calf circumference 6 inches or 15 centimeters below the mid-patella with the leg in full extension. The configuration required is selected according to which side of the knee that is affected. Ask the patient to sit down and extend their leg while fitting the device. Open upper and lower buckles. Ensure that the upper and lower smart dosing dials are set to the 0 position. Place the device on the patient's leg with the hinge on the affected side of the knee. For proper height positioning, align the bottom of the Össur logo on the hinge with upper edge of the patella. Please note, for off-the-shelf braces, an additional yellow line has been added for improved visibility. For proper side positioning, the front edge of the hinge cap should be at the midline of the leg when looking at the side. Place the blue lower buckle button into the blue calf shell keyhole above buckle stability shelf, and use the palm of the hand to snap the lower buckle closed. Adjust the calf strap to the appropriate length by tensioning around the calf and folding into the alligator clip so that it keeps the device securely and correctly positioned on leg. Instruct the patient to bend their knee to 80 degrees. Place the yellow upper buckle button into the yellow thigh shell keyhole and use the palm of the hand to snap the upper buckle closed. Adjust the thigh strap to the appropriate length by tensioning around the leg and folding into alligator clip. Next, adjust the length of the Dynamic Force System straps, or DFS straps. With the patient's knee fully extended, either standing or sitting, adjust the upper DFS strap length until it sits firmly against the leg, and then fold it into the alligator clip. Adjust the lower DFS strap in the same way. Please note, with the patient in the standing position, the back of the brace is accessible to the clinician and allows for easier strap adjustments. Following the initial DFS strap adjustments, the patient should not experience any tension or unloading. Ask the patient to bend their knee with their foot flat on the floor. Turn the upper and then lower smart dosing dials clockwise until indicators are in the 5 position. Have the patient take a few steps to verify the correct positioning of the device and tightness of the straps. Determine optimal DFS strap tension based on patient's pain relief feedback. If the patient requires more or less tension with the indicator at the 5 position, adjust the length of the DFS straps accordingly. Aim for final smart dosing dial setting at the 5 position, since this will give the patient the ability to adjust dosing during daily life activities. If necessary, adjust the position of the alligator clips so they are positioned outside of the popliteal area. This reduces the bulk behind the knee. Ensure that the strap pad is not wrinkled and positioned where the DFS straps cross in the popliteal fossa. Ask patient to sit down with the leg extended. Turn both smart dosing dials counterclockwise until the indicator is at the 0 position to release tension on the DFS straps. Bend the patient's knee to 90 degrees and open both lower and upper buckles. Pull the buckle buttons out of keyholes. When the final fit has been confirmed, trim the straps to the appropriate length.